What is the most effective method to prevent neonatal tetanus? Options are A. Neonatal tetanus vaccination, B. Maternal tetanus immunization during pregnancy, C. Providing sterile delivery kits, D. Administering antibiotics at birth. The answer is B. Maternal tetanus immunization during pregnancy. Immunizing the mother protects the neonate through passive immunity. A neonate has meconium-stained amniotic fluid and is in respiratory distress. What is the priority intervention? The options are A. Suction the airway, B. Administer oxygen, C. Start CPR, D. Provide surfactant therapy. The answer is A. Suction the airway. Suctioning helps to clear the meconium from the airway to prevent aspiration and respiratory complication. So suctioning the newborn with a bulb syringe to clear the mucus from its upper airway, which is very important. You suction the mouth first, then you suction the baby's nose, which is very important. So mouth first, then the nose. So how do you remember this? A burst trick is to remember the alphabetical order. So this is M and N in the alphabetical order. M is before the N. So M is mouth. Mouth first, then the nose. Okay. What is the first line treatment for acute otitis media? Options are A. Amoxicillin, B. Azithromycin, C. Ceftriaxone, D. Erythromycin. The answer is amoxicillin. Amoxicillin is the first line treatment for acute otitis media in children. Acute otitis media is an infection of the middle ear which can cause pain, pressure, and sometimes fever. Which reflex is absent in Erb's palsy? A. Moro reflex, B. Rooting reflex, C. Grasp reflex, D. Sucking reflex. The answer is A. Moro reflex. Erb's palsy, which is caused by brachial plexus injury during birth, which can lead to an absence of Moro reflex on the affected side. What is the common feature of neuroblastoma? Options are A. Hypertension, B. Abdominal mass, C. Hematuria, D. Hypoglycemia. The answer is B. Abdominal mass. Neuroblastoma commonly presents as a painless abdominal mass in children under 5 years. What is the hallmark of congenital hypothyroidism? Options are A. Macroglossia, B. Jaundice, C. Umbilical hernia, D. All of the above. The answer is D. All of the above. The features of congenital hypothyroidism, which is a condition in which baby's thyroid gland doesn't produce enough thyroid hormone, which can lead to a number of health issues, which include macroglossia, which is nothing but large swollen tongue, jaundice, and umbilical hernia. Apart from that, there are other signs and symptoms also. The baby will be sleeping longer and more often than usual, constipation, then weak or floppy muscle tone, then poor or slow growth are which are the other signs and symptoms associated with congenital hypothyroidism. A child with cyanosis relieved by squatting is likely to have A. Atrial septal defect, B. Tetralogy of Fallot, C. Patent ductus arteriosus, D. Coarctation of aorta. The answer is B. Tetralogy of Fallot. Squatting, which can increase the systemic vascular resistance and which can reduce right to left shunting in tetralogy of Fallot. Which condition is associated with high-pitched crying in neonates? Options are A. Hypoglycemia, B. Intracranial hemorrhage, C. Sepsis, D. Hypobilirubinemia. The answer is B. Intracranial hemorrhage. A high-pitched cry is a characteristic sign of increased intracranial pressure, often seen in intracranial hemorrhage. Which of the following reflexes persist into adulthood? Options are A. Moro reflex, B. Palmar grasp reflex, C. Rooting reflex, D. Gag reflex. Answer is gag reflex. The gag reflex persists throughout life, while other reflexes like Moro, Palmar, rooting disappear during the infancy. Which symptom is typical of celiac disease in children? Options are A. Constipation, B. Bloody stools, C. Steatorrhea, D. Weight gain. The answer is C. Steatorrhea. Celiac disease causes malabsorption, which can lead to steatorrhea. Steatorrhea is fatty stools. And abdominal bloating and failure to thrive is a part of celiac disease. And apart from that, it has many other symptoms as shown in the picture. The best site for IM injection in infants is options are A. Gluteus maximus, B. Deltoid, C. Vastus lateralis, D. Rectus femoris. The answer is C. Vastus lateralis. Vastus lateralis is preferred in infants due to its large muscle mass and safety from nerve and vessels. Which condition is associated with delayed tooth eruption? Options are A. Hyperthyroidism, B. Hypothyroidism, C. Marasmus, D. Diabetes mellitus. The answer is B. Hypothyroidism. Hypothyroidism causes delayed skeletal and dental development. A 6-year-old child has hemophilia. Which clotting factor is deficient in this condition? Options are A. Factor 9, B. Factor 8. C. Factor 7. D. Factor 11. The answer is B. Factor 8. Hemophilia A is caused by a deficiency of clotting factor 8. Hemophilia is a rare inherited blood disorder which can cause the blood to clot less, so which can increase the risk of bleeding or bruising. What condition causes a steeple sign on X-ray? Options are A. Epiglottitis, B. Croup, C. Foreign body aspiration, D. Laryngomalacia. The answer is B. Croup. The steeple sign on X-ray indicate subglottic narrowing in Croup syndrome. What is the common complication of untreated otitis media in children? The options are A. Meningitis, B. Sinusitis, C. Bronchitis, D. Epistaxis. The answer is A. Meningitis. Untreated otitis media can lead to meningitis due to the proximity of the middle ear to the brain. Which neonatal reflex disappears first? Options are A. Moro reflex, B. Rooting reflex, C. Palmar grasp reflex, D. Tonic neck reflex. The answer is B. Rooting reflex. The rooting reflex disappears around 3 to 4 months while the others last longer. The calorie requirement for a 1-year-old child per day is approximately, options are A. 1000 kilocalories, B. 600 kilocalories, C. 1500 kilocalories, D. 800 kilocalories. The answer is A. 1000 kilocalories. A 1-year-old typically requires 1000 kilocalorie per day for growth and energy needs. What is the primary intervention for a child experiencing febrile seizures? Options are A. Administer antipyretics, B. Start oxygen therapy, C. Intubate immediately, D. Perform lumbar puncture. The answer is A. Administer antipyretics. Controlling the fever with antipyretics, for example paracetamol, is the primary intervention for febrile seizure. What is the most reliable indicator of dehydration in a child? Options are A. Skin turgor, B. Sunken eyes, C. Capillary refill time, D. Weight loss. The answer is D. Weight loss. Acute weight loss accurately reflects the degree of dehydration in children. Which is the most common pediatric cancer? Options are A. Neuroblastoma, B. Retinoblastoma, C. Leukemia, D. Wilms tumor. Answer is C. Leukemia. Acute lymphoblastic leukemia, ALL, is the most common childhood cancer. A child presents with copious frothy yellow discharge from the ear. What is the likely diagnosis? Options are A. Otitis externa, B. Chronic otitis media, C. Acute otitis media, D. Mastocytitis. The answer is B. Chronic otitis media. It often results in persistent otorrhea and tympanic membrane perforation. Which congenital heart defect causes a machinery-like murmur? Options are A. Atrial septal defect, B. Ventricular septal defect, C. Patent ductus arteriosus or PDA, D. Tetralogy of Fallot. The answer is C. Patent ductus arteriosus. Patent ductus arteriosus, which is characterized by a continuous machinery-like murmur heard at the left upper sternal border. The ductus arteriosus, which is a temporary structure in the fetal circulation between pulmonary artery and the aorta, which is usually closes within hours of birth, but when it fails to close, the PDA happens. So there are other assessment like widened pulse pressure, bounding pulse associated with PDA apart from machinery-like murmurs. What is the mainstay treatment for acute otitis media in children? The options are A. Analgesics, B. Antibiotics, C. Steroids, D. Antihistamines. The answer is B. Antibiotics. Acute otitis media is treated with antibiotics, typically amoxicillin, to combat the bacterial infections. Which is the most common cause of neonatal sepsis? Options are A. Group B. Streptococcus, B. E. coli, C. Staphylococcus aureus, D. Listeria monocytogenes. The answer is A. Group B. Streptococcus. Group B Streptococcus is the leading cause of early onset of neonatal sepsis. Which of the following is contraindicated in breastfeeding? Options are A. Maternal HIV, B. Maternal TB, which is on treatment, C. Hepatitis B, D. Jaundice in baby. What is the ideal method for rehydrating a child with mild dehydration? Options are A. Oral rehydration therapy, B. IV fluids, C. Subcutaneous fluids, D. Nasogastric fluids. The answer is A. Oral rehydration therapy, which is the most effective and least invasive method for managing a child with mild dehydration. Which sign is an early indicator of hypoxemia in children? Options are A. Cyanosis, B. Retractions, C. Tachycardia, D. Clubbing. The answer is C. Tachycardia. Tachycardia is an early sign of hypoxemia, while cyanosis and clubbing appears later. What is the primary cause of kernicterus in neonates? Options are A. Hypoglycemia, B. Hypocalcemia, C. Severe hyperbilirubinemia, D. Hypothermia. The answer is severe hyperbilirubinemia. Kernicterus occurs when excessive unconjugated bilirubin crosses the blood-brain barrier and deposits in the brain. What is the hallmark of kwashiorkor in children? Options are A. Muscle wasting, B. Edema, C. Severe dehydration, D. Weight loss. The answer is B. Edema. Kwashiorkor is characterized by edema due to hypoalbuminemia, even though child may appear well nourished. What is the therapeutic level of phototherapy for neonatal jaundice? Options are A. Bilirubin more than 5 mg per dl, B. Bilirubin more than 10 mg per dl, C. Bilirubin more than 15 mg per dl, D. Bilirubin more than 20 mg per dl. The answer is C. Bilirubin more than 15 mg per dl. Phototherapy is initiated when bilirubin level exceed the age and weight specific threshold, which is commonly more than 15 mg per dl. Which condition is characterized by painless hematuria in children? Options are A. Nephrotic syndrome, B. Wilms tumor, C. Glomerulonephritis, D. UTI. The answer is B. Wilms tumor. Wilms tumor, a kidney malignancy, often presents as painless hematuria or an abdominal mass. What is the initial sign of puberty in girls? Options are A. Menarche, B. Breast budding, C. Growth spurt, D. Pubic hair development. Answer is B. Breast budding. Breast budding, otherwise known as telarche, is the first physical sign of puberty in girls, typically occurs between the age of 8 to 13. What is the primary clinical feature of heat spring disease? Options are A. Projectile vomiting, B. Failure to pass meconium, C. Hypoglycemia, D. Seizures. The answer is B. Failure to pass meconium. Hirschsprung's disease involves absence of ganglionic cells in the colon, leading to intestinal obstruction and failure to pass meconium. What is the primary cause of respiratory distress syndrome in preterm neonates? Options are A. Infection, B. Surfactant deficiency, C. Pulmonary edema, D. Bronchopulmonary dysplasia. Answer is B. Surfactant deficiency. RDS in preterm neonates is caused by immature lungs that lack sufficient surfactant, which reduces surface tension in the alveoli and prevents collapse. What is the hallmark feature of nephrotic syndrome? Options are A. Hematuria, B. Proteinuria, C. Hypokalemia, D. Hypertension. Answer is B. Proteinuria. Nephrotic syndrome is characterized by massive proteinuria, hypoalbuminemia, and edema. Which is the most common cause of bronchiolitis in infants? Options are A. Influenza virus, B. Adenovirus, C. Respiratory syncytial virus or RSV, D. Parainfluenza virus. The answer is C. Respiratory syncytial virus. RSV is the leading cause of bronchiolitis in infants, typically presenting with wheezing and respiratory distress. What is the common sign of congenital diaphragmatic hernia in a neonate? Options are A. Absent bowel sounds, B. Cyanosis and respiratory distress, C. Scaphoid abdomen, D. Hyperactive bowel sounds. The answer is C. Scaphoid abdomen. A scaphoid abdomen and respiratory distress are key signs due to herniation of abdominal organs into the chest cavity. Which condition is indicated by a positive ortholani maneuver? Options are A. Talipes equinovarus, B. Developmental dysplasia of the hip, C. Leg clave-Firth disease, D. Slipped capital femoral epiphysis. The answer is B. Developmental dysplasia of the hip. A positive ortholani maneuver indicates instability or dislocation of the hip joint, commonly seen in DDH. What is the drug of choice for treating a child with Kawasaki disease? Options are A. Aspirin and IV immunoglobulin, B. Steroids, C. Paracetamol, D. Antibiotics. The answer is A. Aspirin and IV immunoglobulin. Kawasaki disease is treated with high dose of aspirin and IVIG to reduce inflammation and prevent coronary artery aneurysms. A positive Gower sign is indicative of options are A. Spinal muscular atrophy, B. Duchenne muscular dystrophy, C. Guillain-Barré syndrome, D. Myasthenia gravis. The answer is Duchenne muscular dystrophy. It indicates weakness in the proximal muscles, which is a hallmark of Duchenne muscular dystrophy. To know about more, it is a progressive weakness and wasting of muscle, the onset of 3 to 5 year old, and usually it is genetic, primarily affects male. And as you can see in the picture, there are many signs and symptoms. Waddling the gait, ambulation will be very frequently impossible by the age of 12, and breathing muscle become more affected, usually life-threatening, and death is caused by the age of 15 to 18 years. So these are the signs and symptoms of Duchenne muscular dystrophy. If you find the video useful, please don't forget to like, share, and subscribe the channel Nursing Exam Insight, your ultimate resource for all nursing exams. Thanks for watching.